Zaha, Neurosurgery Medical Officer, IGMH, and I'll be presenting our study on spine trauma series conducted in IGMH based on the data collected over the past year. Traumatic spinal injuries are a health concern affecting 250,000 to 500,000 people per year worldwide. As per WHO, the acute mortality rate can range from 3 to 13% depending on the severity and associated complications. However, local data from the MODIS has been extremely limited, and that was the motivation for this study. This was a retrospective study conducted in IGMH, which is the main referral center in Maldives. We reviewed cases between June 2024 to June 2025, and a total of 38 patients were included. The main objective was to evaluate the etiologies and outcomes of spinal trauma in our setting. We included patients who presented to IGMH with radiologically proven spinal fractures following trauma. We also included osteoporotic fractures due to trivial trauma. However, we excluded any spontaneous pathological fractures related to oncological causes. We recorded and analyzed demographic and occupation, mechanism of injury, fracture morphology, Asia classification, and functional outcome discharge. Looking at the results, for gender distribution, the majority were males consistent with occupational risk profiles. Looking at the age groups were predominantly young to middle-aged adults, the working population of 31 to 40 years. Mechanism-wise, falls were the most common, followed by road traffic accidents. One of the most striking findings was the fall from height was the most common mechanism of injury in our study. This includes falls at construction sites, largely due to lack of proper safety precautions, falls from trees, especially coconut and breadfruit trees, falls from within boats, a common mode of transport in island communities, and slip and fall incidents in bathrooms. Many of them are related to osteoporotic fractures. Notably, a large proportion of the injuries occurred in foreign workers engaged in manual labor, emphasizing the occupational vulnerability of this population. The L2 vertebra was the most commonly involved site, which is consistent with thoracolumbar trauma patterns in vertebral falls. Looking at the AO classification, the AO classification categorizes thoracolumbar spine injuries based on the primary site involved, vertebral body type A, a posterior element type B, and displacement or dislocation type C. The AO spine classification revealed A1 type fractures as the most common subtype, particularly in the thoracolumbar region. We also assessed Asia classification. Neurological status was assessed using the Asia scale. The Asia classification grades spinal cord injuries from A to E. A is complete, no motor or sensory function. B is sensory, incomplete, some sensory, but no meaningful motor function. And C and D, motor incomplete, motor is preserved, but strength varies. E is normal function. We observed significant functional recovery in most patients, that is 68%. Only one patient had persistent neurological deficit. The Asia scale proved reliable in both preoperative and follow-up assessments. Looking at the management approaches, about 38 of cases were required surgical intervention, and 61% of the cases conservative. Functional outcome. 72 patients showed stable or improved ASIA grading postoperatively, and only one patient had complete core injury. We compared two already published papers, that is Mantu, Jain et al. And Lars Sweden Orden, and all studies reported male predominance. It was highest in our study, and the Mantu Jain Indian cohort likely due to similar labor. Looking at the age category, our study and the Mantu Jain et al. Both showed peaks in the working age population, and less Hayden Orden showed a high rate of pediatric trauma, possibly due to different recreational activities or reported practices. In contrast to our study where occupational injuries were most common, both the Mantu Jain et al. And Lars Sweden studies found falls to be the leading cause. This slide compares the pattern and extent of spinal injuries observed in our study with the findings from international literature. In our study, the majority of the patients had single level spinal injuries. In contrast, a study from India by Mantu et al. Reported multi-level injuries, and similarly in a study conducted in Netherlands by Lars Sweden, multi-level injuries were also frequently observed. This is a comparison of spinal injury studies. To conclude, our data reflects trends similar to India and Netherlands. Falls and workplace trauma among amateur floaters are major contributors. This study highlights the urgent need for better occupational safety measures, especially for foreign